from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed.
Jordan is the director of training at Minding Your Mind, a nationally recognized speaker on mental health, suicide prevention, and recovery. After surviving a suicide attempt during his senior year of high school, Jordan turned his story into a mission to help students, families, educators, and communities talk more openly about mental health and the importance of asking for help. For more than a decade, Jordan has traveled the country speaking to students, parents, educators, school staff, colleges, and mental health professionals, helping people better understand depression, breaking the stigma around asking for help, and finding healthier ways to cope. His work has been recognized nationally, including being named one of the 2010 Best of Philly for mental health awareness and public speaking, receiving an Emerging Humanitarian Award, and being featured by major outlets, including Sports Illustrated, People Magazine, USA Today, CNN, Good Morning America, and more. Jordan, welcome to The Missing Piece. I'm really grateful to have you here and excited to hear more about your story. Thank you for taking the time to be with us.
Of course. Thank you for having me.
The pleasure is all mine, but for our audience that has never met you before, I know I did a brief intro, but I'd love for you to introduce yourself. Who are you? What do you do? All the things. How did you get to where you are today? So go ahead and introduce yourself.
Yeah. So, hello, everyone. My name's Jordan. I speak for an organization called Minding Your Mind. And basically what we do at Minding Your Mind is we like to have speakers go into middle schools, high schools, colleges, and share their stories. And so for me, I've been sharing my story for Minding Your Mind for the past 18 years now. And it's been an amazing opportunity to not only do that, but my other job is to train speakers who also want to share their stories. So long story short, my job is basically to share my story and help others share theirs.
I love it. And I know we're going to get into your story a little bit. Would you be willing to kind of share your story? Take us back to the beginning and even what brought you to Minding Your Mind, which I know, like you had mentioned, it was from a personal story. If you wouldn't mind just walking us through that, that would be incredible.
Yeah. So for me, leading up to my senior year of high school, I struggled a lot with my mental health. I was diagnosed with depression when I was in 10th grade, but I really wasn't sure how to cope with it or how to talk about it. There really wasn't a blueprint in terms of or modeled in any way of how to talk about my mental health or simply how to ask for help. So I struggled a lot in terms of coping mechanisms and also being able to just share and express how I was feeling. And that led up to my senior year of high school. The beginning of my senior year of high school, I attempted suicide by going out of my 9-story bedroom window. And as you can imagine, just devastating injuries. I was in the ICU for 2 weeks. I was in a coma for 5 days. I still don't remember, one moment of being in that ICU. But I wake up, I'm in a hospital, and I have no idea why I'm there. One of the things is that I don't remember actually going out of my window. I remember everything else leading up to that moment. I remember my class that morning, physics, my golf that day. I could describe every hole golfing, the car ride home with my dad, but going out the window is just something I don't remember. And my suicide attempt was impulsive. I didn't plan it. I didn't write a letter or a note. That was a Friday that started out just like any other Friday of high school. I didn't wake up that morning thinking, this is the day I'm going to attempt suicide. But for whatever reason, when my dad and my mom talked to me that night about alcohol that I had been drinking, it got to a point where I thought maybe life would be better for other people if I wasn't here. So at that point, I'm laying in the hospital. I'm 18. I'm down 80 pounds. I can't move. I can't talk. I've been told by doctor after doctor that I would never walk again, that I would never get out of a hospital bed. But during this time period, while I was in the hospital, there was a reporter from the Philadelphia Inquirer newspaper. His name's Michael Vites. He reaches out to my dad and asks if he could interview me. And, the first person my dad talked to naturally is my mom. My mom said no to this original interview. She thought it was too soon, something I may regret later down the line in life. My therapist at that time thought this was a terrible idea. But ultimately, they left it up to me. And I remember when my dad asked me if I would do this interview, if I would talk to this reporter for the first time, I said yes almost immediately. within that first conversation because of all the things that I just mentioned. I really wasn't sure what would be the next step in life. Also, it's not like anyone really wanted to talk to me or knew how to talk to me about what I was going through in that moment in time. So to be able to share my story is something that I felt passionate in doing and hopes to hopefully make a difference. If someone could read my story and gain any type of hope from it, that's what, the main thought was going into it. But I thought it would be a story in the local section. I thought it was something that people might read during that time period, but I really wasn't expecting the amount of feedback that it received. The article came out in January of 2008. I had no idea until the day before that it would be the front page of the Philadelphia Inquirer newspaper. Had no idea it would run across the country. So I definitely wasn't expecting the amount of feedback that it received. And it was amazing to hear from people who thanks my family for sharing this story. But I still really wasn't sure what would happen in terms of my senior year of high school and what would come next. And so during that time, I was in the hospital for 5 months. I was finally able to go home. I was homeschooled for the rest of my senior year of high school. And during that time period, that's when someone from an organization called Minding Your Mind reached out and asked if they could just sit down, talk to me, my dad, my mom, and just tell us about this organization. And so they invited us to a panel discussion that was being had. And, I was excited because there were 4 speakers. And one of them was this actor, Joey Pantoliano, who I knew from The Matrix. He's in a lot of movies, but I knew him from The Matrix. So I was like, oh, we should go with mental health and, The Matrix. And so we get there and we listen. Everyone does a great job. They open it up for Q&A, and the Q&A starts out like every Q&A. It's just awkward silence. And so at this point, I was in a wheelchair. So I asked my mom, can you wheel me to the microphone to ask me a question? And I don't, honestly, I don't know where this came from, but I just grabbed the microphone and I said, my name is Jordan Burnham. And this past September, I attempted suicide by going out of my 9-story bedroom window. The question that I have is, how can we help young adults talk about suicide in an open and honest way? That was that night. I didn't think much of it. I went back home and 2 weeks go by and I'm getting ready for my friend's prom. And that's when Joey's agent emailed my dad asking if I wanted to go speak to Congress and share my story alongside him. So that was my first time ever publicly sharing my story was to Congress. So I did that. Still at that point, I'm still not thinking like this is going to turn into a career or something that I would be doing for a long time. I just thought public speaking is something I might get into maybe for a few years. But my first presentation was October of 2008. I was a mess. I was sweaty because there's like 1,000 students and I'm nervous and I wore gray, which wasn't a good idea when you're sweating. And so I had no cards. They were out of order. And, I do this and I speak and it's a terrifying experience. But the reason why I still do this is not because of that presentation itself and how it went. The reason why I still love doing this is because afterwards, there was just this line of students who came up to talk to me, to ask me personal questions. But a lot of times it was just them sharing how they could relate to the story, the things that they really connected to. And that's when I realized that this job isn't just about me sharing my story, but a chance to hear others. And so, yeah, that's how I got involved with Finding Your Mind. That's how I found out about them and why I'm still with them today.
It's absolutely incredible. And, I'm really sorry you went through that. I am, you are not in a wheelchair anymore, are you?
No, it was a long but steady physical recovery. It took 4 years to be able to walk again. But it's funny because walking was never the goal. The goal was to become physically more independent, and whatever came about, that I was content. I was happy with. So when I walked for the first time, it wasn't like that was really the goal because in my mind it was impossible to be at a point where I would be able to do that. But the one thing that looking back, I do appreciate is that the doctors were very honest. So I was 18. So I was in a hospital where, they treat you and talk to you like an adult. And they were very honest with me about what the future might be for me physically. And the doctor who told me that I would probably never walk again, that's probably one of the best things he could have said, because anything above just being in a hospital bed to me was a miracle. To not only be alive, but to be able to move my left leg for the first time, be able to get out of a bed for the first time. Those are the things that if he would have said it's going to take 4 years to walk again, that would have felt devastating. But because there were no expectations, I think that's why I was able to embrace the journey, physically being where I am today.
Yeah, that's incredible. And it's interesting because like you said, if you have expectations or unrealistic expectations that can keep you from, your future, or you can play the mind games, of disappointment or hopelessness, or, the things that come with it. And it really comes with expectations. So going back, to your senior year, and you are struggling with mental health wasn't talked about as prevalent as it is today. Back then, there was it was, I don't wanna say that it was hushed upon, but it wasn't something that was openly addressed. Um, how has that changed? Like, working with Mind Your Mind and in today's society with mental health, how do you feel, that even minding your mind and your voice is able to help others in their mental health journey and breaking that stigma or silencing the mental health, that someone might be having.
Yeah, I think that uh, our ability as a society to talk about mental health, I think, stems from two things. And I think there's a third thing, but that has more to do with how we go about the first two. I think the first is storytelling. Stories add context to facts. I could give you statistics about suicide or about depression, but unless I tell you a story that really illustrates how it can affect someone, how it might feel, how it might sound when
Mhm.
someone is depressed or when someone is having suicidal thoughts, I think that's why stories are so important in just getting the message of mental health out there and normalizing so many of the things that people can feel like they're alone with. So I think there's storytelling, which I'm fortunate to be able to do, and Minding Your Mind really does a great job with. The second thing is education. The education that we are able to provide to students is something that has gotten easier because this is the most we've ever known about mental health, about coping mechanisms. I think this is the best we've ever been in terms of having a healthy conversation and being responsible with those conversations. And that really just comes from time and patience in mental health advocacy because it's still a fairly new idea and mission of mental health advocacy compared to, I always think about like breast cancer awareness took decades and decades to be able to get to a point where breast cancer was no longer stigmatized in the way that it was earlier on. So, I mean, that took legislation, that took storytelling, especially when it came from celebrities talking about having breast cancer. It came through education as well, the right treatment. All of that took a really long time to get to the point where people are wearing pink, in the NFL. NFL players would wear pink in October, or there would be a walk. There's suicide prevention walks. There are breast cancer awareness walks, I should say. And that is something that we get to by normalizing the conversation through storytelling, through education to be where we are today. And so for me, I think of mental health advocacy of we're still in the early stages of figuring this out in terms of what is the best way to go about having these conversations, what's the best way to go about education. But it seems like storytelling has been a really great way to be able to lead to those avenues.
And obviously, you're an incredible storyteller, and now your life is to connect with people with not only your story, but maybe even theirs. Being that you are a storyteller probably every day, because this is what you do for a living, what is it that you hope that students or adults or anybody that you're speaking to or educating, what are what is it that you hope they walk away with? Like after engaging with not only your story but minding your mind. What's your impact that you are hoping, like, man, I hope they walk away with this. What is that?
Yeah, I think that it's the ongoing conversation about the topics that are brought up that day. I'm fortunate that I've been able to hear some feedback from students or from faculty members years after I spoke at a school. And one of my favorite things to hear is that our school is still talking about the presentation, or our class is still talking about the presentation or about minding your mind that day. And to
Yeah.
me, that's what kind of the goal is to be able to set a foundation for the conversation to happen, because I'm sure there are plenty of students who can go to school and they could be around hundreds or thousands of students, but they can feel really alone. And that concept in itself might not make sense to someone who thinks, well, if they're surrounded by friends or they're surrounded by, teachers, faculty, staff who love, how can they feel alone? And to me, what I think it is that if you don't know anyone who might be going through something similar to you, then it can feel very alone. Just like I think of it as, so I live outside of Philadelphia, so I know a lot of Eagles fans. Eagles fans do not like Cowboys fans, and that's just how football goes. And if a Cowboys fan were to walk into a group of 100 people watching the football game, and they were the only Cowboys fan, they would feel really alone. They're around 99 other people, but they would still feel really alone. And it wouldn't be until a second Cowboys fan walked in that immediately there would be a connection. There would be like, hey, tell me about yourself, how long you've been a fan. And it would kind of go into this direction of, oh, we can talk and we can connect because you have a similar interest to me. And I think when it comes to mental health, if you don't know anyone who has stress, who has anxiety, if you don't know someone who has a mental health disorder, having depression, especially for me, I didn't know anyone in my high school who went to see a therapist, who was taking medication, anything. So because I felt like I was the only one doing all of that, even though I had friends, even though I, had people around me at school, I still felt very alone because I felt like there was no one there I could truly connect with how I was feeling and to what I was going through. So what we try and do through sharing our stories and through education is to normalize the conversation, of course, of mental health, but also to make students feel like they're not alone with what they might be going through. And I've heard it before from students who would come up to me after a presentation and just say, I thought I was the only person who was struggling with this, or students who say, you told my exact story of something that I've been through or something that I'm currently going through. And to me, that's what the hope is that we talk about education, we talk about storytelling, but the third component of this is seek helping behavior. And if I leave, and this is honest, this is true. If I leave and no one remembers my name, or they don't really remember the specifics of my story, but they still remember the message, and that message got them one step closer to a counselor's office, that's the goal. Like if they can feel less alone, if they can feel like the conversation is normalized, but if that walk to the school therapist, school counselor's office is just a little easier to get to, then that's what I always hope.
I love that. I love that. It's an impact. It's leaving, your story, like you said, not having somebody feel unheard, and getting them to feel heard, and hopefully that makes a difference in their life. So let me ask you this, because you do this every day, specifically in schools, but do you feel like the schools still don't maybe know how to talk about depression or anxiety or suicide, or put together, emotional plans within the school system? Or do you think that they are figuring that out slowly? Like, do you believe that it's still missing? I mean, it's talked about as a whole, but curious if the school is addressing people openly talking about it at school.
Yeah. I think that schools are doing an incredible job. Over the past, and this is, I can say this, over the past 18 years of doing this, in that schools, it was really hard for us to really get into schools and be able to share stories and talk about mental health when we first started back in 2008, when I first started speaking. So to me, the fact that we're here now, getting into like the first year that I spoke for Mind Your Mind, we did, I think, like 30 presentations total. And now we're at the point where we do over 2,000 presentations in a school year and have over 20 speakers. So it's really grown in terms of the embracing of the message. And especially, I think, after the pandemic, I think that opened up a lot of eyes for parents who saw their children struggling in front of them versus them being at work and them and their students, or excuse me, their kids being at school. It was kind of their first time witnessing that in real time. So I think that also helps in terms of middle school presentations, especially, and being able to go into education into that as well. What I would say is that schools are doing a great job of opening up that conversation and opening up some of that space to be able to talk about mental health. Is that every school? No, absolutely not. I think there's a spectrum of the ability for students to talk about mental health openly in certain schools versus other ones where it might not be that way. But the goal to me is that when I was in high school, we had a school psychologist. I didn't know we had a school psychologist until my junior year of high school, when I went to a behavioral hospital. When I got back, that's when I was introduced to her. So at no point in ninth grade, 10th grade, or the beginning of 11th grade, we had plenty of assemblies, plenty of conversations, everything. At no point did anyone say, hey, you might be struggling at some point. We have a school psychologist here, and this is where her office is if you ever need to go there. Or I think to me, the bigger message that should have been in there was you can go talk to the school psychologist and talk to them about the basketball game. You can talk to them about a really great score that you got on a test. It does not have to be the end of the world or a big problem that's happening for you to go and talk to a counselor. And what I love is, I was just speaking last week and I was introduced by the school counselors, social workers, I should say, the school social workers. And the fact that those students know who the social workers are, the fact that there are 3 different social workers that students can go to, and the fact that coming up to them and talking to them is a normal thing, and that it's not like, oh man, they're going up to talk to the school counselor. I wonder what's going on. The fact that they felt okay to laugh and joke and come up and talk to them, to me, says a lot about where we are of that third part of help seeking behavior. And that's where I think schools we're always going to have room to grow as a society, but especially in schools, in terms of the resources, having school counselors, having school social workers. I think we still have to get there, but the conversation themselves, I think, have gotten a little easier because I think teachers can now have those conversations inside classrooms, especially health teachers, versus having to do a full assembly. And I love doing assemblies, I do. But I think those health classes where they're learning about mental health in that way is just as important. And so I think that's why we're leading a positive direction of students feeling one, like they can open up, but 2, having the vocabulary, knowing how to open up and who to open up to. So I think we're going in a good direction there.
Yeah, that's awesome. I agree. And I'm seeing it too. And it's exciting because back then, to your point, you probably felt isolated and alone. And now organizations like Minding Your Mind and what you work for is able to, you're being invited into the school system and to have open conversations, which is hopefully making a difference, the impact. So I know you're the training director, and you've been at the organization from almost the beginning. So, as one of the leaders at the organization and training up people under you and your understudies, what is some of your leadership skills and styles that you use and leverage to basically create that impact and that ripple effect that you're doing? Like, how are you leading and training others?
Yeah. Working with speakers and helping train new speakers, but also 2, getting a chance to see current speakers grow over the years as they continue and getting a chance to talk to them about things they like to change with their presentation is one of my favorite things about being at Minding Your Mind, all of it, because the speakers really make the organization what it is. I mean, we could not exist without speakers going into schools. So the fact that these incredible humans are willing to share their story to me is so powerful, and I'm glad I get to be a part of that process. The process is something that we really put a lot of thought into, which is why I think it goes as well as it does. Where we have my coworker Michelle, who is able to have speakers reach out to her who are interested in the process. She interviews them, and then that's when she hands them off to myself and my coworker Caitlin. And Caitlin is the one who works with them on their scripts and their narrative, their storytelling, so that by the time they come to me and we go through training, I get to work on the public speaking side of being a speaker. And so when to pause, when to slow down, when to take your time when answering certain questions, how you create a moment where the audience can really hone in on a detail that you're saying or the education that you're putting in there. Public speaking, it's an art. It's an art to be able to articulate yourself in a certain way whenever you're sharing your story, but also do it in a really thoughtful way so that there's some humor that you might add in here at the beginning of the story so that whenever you are talking about something a little more serious, 10, 15 minutes later, it kind of hits different because the audience now trusts you because you made them laugh. Whenever you slow down at certain parts where you're holding tension for the audience, talking about the ways to hold that tension for the audience, but to be responsible with it. Because ultimately, yes, we have an opportunity to share our stories, but these students also have to go to class, next period. And so we try our best to have people share their story in a way where we're giving the entire nuance of everything that they've been through, the entire experience, of what they go through that they want to share. But at the end of the presentation, one of my things also that I love is that we get to talk about life today. And talking about, yes, of course, something that we went through however many years ago, but now we get to talk about how we take care of our mental health today, the people that surround us, that are support systems that we have. Those are the things I love that all of us, our speakers, talk about at the end there. So that way, it's not just talking about the story of what happened, but it's really talking about a story of what happened, why it happened, and where we are today. And that offers, I think, not only perspective, I think there's also a part there where I think education comes through distinction, where a lot of the speakers that share their experiences and stories, if they talk about having, for instance, depression or anxiety, they will talk about specifically how it affects them versus what you might hear from someone else or on social media. So I think even clarifying that within stories is really important. And that's what we try and do, of spreading that message of education, having people feel like they're not alone, but also at the same time, there are jokes that we like to tell. We like to add our humor in there. We like to add our personalities in there so that it's not just something that we're saying, but it's something that we feel passionate and we feel confident in saying as well.
Love it. For listeners, adults, or maybe students, or even youth, or parents that have youth that are struggling with mental health, where can they go find resources? What is the next step? Like what step 1, 2, and 3 for those that are saying, "Man, yep, that's me. I feel alone. I feel anxious. I've definitely been depressed. I haven't told anybody." And or I'm not sure what to do or where to go, what do they do? What are the next steps?
Yeah. I think that's a really important question because, like we said, there's the story side of it where you get to hear a story. Then there's the education piece of someone learning about something they might be going through right now finally have a name to it. But then that third part is really what is the help seeking behavior that we can apply for someone who might be struggling, or if you have a child who might be struggling. So mindingyourmind.org, we have a whole site of resources, especially in different regions for people. So that way, you know exactly, depending on what you might be going through, you know exactly what phone number to call, what website to visit. So that way you can find the resources that are readily available to you locally, and things that are specific to what you might be going through. So I always encourage people to go to mindingyourmind.org to see those resources. I mean, there are websites like, NAMI, National Alliance of Mental Illness, that does a great job too of having resources on the website as well. So like I said, this is the most we've ever known and understood about mental health. And because of that, I'm glad that we have as many resources as we do for as many specific things that can happen with someone with their mental health and what they might be going through.
Thank you for sharing that, because I do know that people are going to go and look and want to be a part of that, and just you need education. They need more information. So our last question, I call the show the missing piece, and do you have like a missing piece in your own personal journey or even your professional journey? Um, that either changed everything for you. I mean, obviously you shared a lot of your story, and or the missing piece that you would love to see in the future to continue to be a part of, or to solve, or does something come to mind when I ask that question around the missing piece?
Yeah, I think for me, it comes back to something I mentioned earlier was breast cancer awareness and how much time it took to erase and break the stigma, where there was a time where you couldn't even say that, to erase the stigma surrounding breast cancer awareness. And the thing that I mentioned was hearing stories, especially from celebrities, people that were well known that had no idea might be struggling with that or diagnosed with that. There's then the part of education, especially when it comes to the resources, education as far as the treatment that they might need. But the third thing is legislation. And that's the biggest thing, because that has allowed the money that goes into resources that we might need today, especially when it comes to schools. If you have that, then especially with legislation, that gives you an opportunity to have more resources and programs within schools, like having a Minding Your Mind presentation or different programs that can come in. So that way, not only do we have a mental health presentation, for instance, in high school, my hope is that that's not the first time someone hears a story about mental health. My hope is that from elementary school to middle school up until high school. At some point along the way, they've heard stories, they've had education, and they have the resources to rely on when they might be struggling. And all of that, honestly, comes through legislation and being able to use our voices to amplify the things that we need, especially when it comes to mental health advocacy. So I think that is the missing piece that I will always continue to fight for and will always continue to use my voice for, whether it was Congress or, the White House. I got to speak at the UN. To me, all of that is incredibly important because bringing mental health advocacy and awareness to the forefront is what's going to lead us to the change that we obviously want when it comes to help and also people talking about it as well.
Well, I think, Jordan, you're going to be a part of that movement for sure. I know you already are. And I love that. I love that. Talk about making a massive impact, nationally and then hopefully internationally. That's incredible. I'm glad I asked that question. And I'm going to be excited to watch your journey and your advocacy and stand behind you and cheer you on because we need to be talking about it and people need resources and they need help. They don't need to feel alone or isolated or end up, in your situation. And I'm so thankful that you shared your story with us. I'm thankful that you are here to share your story to others and the impact that you've been making and will continue to make. So thank you for your time. If people want to reach out to you, how should they just find you on LinkedIn? What is the best way to reach out to you?
Yeah. So if you go on the mindingyourmind.org website, I believe my email address is up there, but my email address is jordan@mindingyourmind.org. If anyone wants to reach out to me for whatever reason, I always love hearing from people, love trying to make connections, especially with our organization. So please feel free to do so.
I love it. Well, thank you for being here and sharing your story. Really appreciate it so much.
Thank you.
Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.